With dental aligners coming into the field, a lot of dentists are scared whether they should get into the aligner loop or stay away from it. The purists think aligners are from hell, whereas the innovators think aligners is the next new thing they need to try. So in today's video, we are going to talk with the founder of 32Co, Dr. Sonia, who's going to tell us how the aligner industry evolved in the European and American markets. Because we have seen that the Indian market tends to follow those countries afterward. So we are going to discuss questions such as whether general dentists should get into aligners. If they start with aligners, what are the common problems they feel? Where are the orthodontists' role in all of this? Dr. Sonia Szamocki is a medical doctor from London and a CEO of 32Co. She's an Oxford graduate. While practicing as a doctor, she founded her first educational business. She then went on to Boston Consulting Group and then into health tech. She was involved in building the world's largest app for patients of hemophilia. She founded 32Co with the aim to empower every dentist and orthodontist globally to provide clinically rigorous, clear aligner treatment with confidence. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. Hi, Dr. Sonia. Thank you for taking your time to join us today. You're someone who has had an overview of the entire aligner industry from since its conception. So I wanted to know what is your opinion about how aligners started and where is it today? And what is your opinion about where it will end?
Hi Satish, thank you for having me on. Yeah, I think the aligner industry has been fascinating to follow over the last two or so decades that it's been around. So for those who are not familiar, the aligner was actually invented in the sort of late 90s by two students in Stanford University who came up with this new concept of teeth straightening using a removable plastic device that would exert similar forces to a fixed appliance, but would obviously be invisible, much more sociable and sort of nicer to wear. They built that into a company called Invisalign, and fast forward many years, after which it went public. It became an extremely successful company and still is a successful company. Um, in 2018, it was valued at 2019, in the tens of billions. Um,
Wow.
they had a patent on that technology until about 2017, which meant that obviously they were the only ones who could create aligners, and that was obviously great for them. It meant unencumbered access to the market. And when that patent expired in 2017, that meant that anyone could use and improve on this technology and use it to create their own clear aligner brands and their own models of distributing clear aligners. And that's when things really started to change. So that's when we saw the first direct to consumer clear aligner. So in India, for example, I think the DIY aligner industry is relatively new, but it's been around for a number of years. And the first people to do it were Smile Direct Club. They had investment from Invisalign at the beginning, and they went directly to the patient with no dentist in the middle, and that was wildly successful for us for a short period. They came into some difficulties which we can discuss, but that was certainly one new way of offering clear aligners to patients. At the same time, we saw many more clear aligner brands and manufacturers that popped up and started working with dentists. And then a whole ecosystem erupted really around treatment planning and marketing and shipping, and the whole kind of system evolved to what it is now, which is a very exciting, very dynamic market that is in different stages in different parts of the world.
Understood. You have been tracking the industry. You've also seen that even though there are aligners, you have other forms of braces which still exist. Why are you such a big proponent of aligners as such?
I think this comes from two places, but firstly, as a clinician, your role, I think, is to serve your patient, and patients want aligners. They are subtle, they are invisible, they're much more appropriate for adults who are looking to improve their smile. So there are thousands of patients that will come into your clinic as a practitioner who have malocclusion, who are unhappy or unconfident with the way that their teeth look, and people are becoming more and more aware of that, especially spending more time on Zoom. And so people want a way to make their smile look nicer. But for many people, having to wear a metal fixed appliance, especially as an adult, is just unconscionable. It's not something that they really want to do. So having an alternative which is invisible, which you can remove, which fits around a patient's day-to-day life, means that they can get the best of both worlds. They can have, the improvement in their smile, perhaps in anticipation of a big event like a wedding, and it doesn't have to be something that everyone can really clearly see.
Understood. Now, there are three schools of thought in this. One is you need to leave braces, aligners, everything to the orthodontist because they're specialized in it. There's another school of thought who says that general dentists can do it because they have rough idea and some amount of learning they can get into it. And on the third hand, you have the D2C, that's the direct to consumer brands who think you do not need even a dentist. Just scan, put it into the computer, the AI comes out, shoots up a tray, and you just give it to the patient. Between all this, how do you feel that a general dentist should get into it? Does it really make sense for them to get into aligners? And do you think general dentists should be doing it?
Yeah, no, it's a great question, and there's a lot in what you asked, and really, what we'll discuss kind of leads into why we built 32Co and the way that it is today. But I think to your first point, I think actually clinicians of all types, dentists and orthodontists, have a responsibility to offer treatments to their patients, because they are the gatekeepers to good quality care. So even if you're not deciding to provide aligners, I think at least you should be aware of them and be able to advise your patient on where best to go for high quality, safe treatment. I think the other important thing to mention is that this is a specialized treatment, as you sort of allude to. This requires an understanding of dentistry and also an understanding of orthodontic tooth movement. And that means that that third category of removing the dentist entirely, for me, is not a solution to the problem. The problem being that patients who want their teeth straightened need someone to sort of design the tooth movement so that it's safe and effective. We can probably touch upon that a bit later, but certainly the evidence suggests that DIY aligners don't give patients the outcomes that they're looking for. So let's focus on
Understood.
the clinical workforce. Both dentists and orthodontists, when we talk to them, tell us that the aligner is new to them. The mechanics are new, the device is new, the workflow is new. So everybody has some learning to do, and that's what we do very well at 32Co. We train and educate people in the use of aligners, and we do that in a very personalized way. So a dentist will not get the same training from us as an orthodontist. But still, it's new, right? You have to understand how this thing works compared to, let's say, fixed appliance or something completely different in dentistry. So that means that we have two different roles really for the dentist and the orthodontist, but neither of them should be excluded from the provision of this treatment. General dentists are an essential part of orthodontics. When you go to an orthodontist, very often they will be adamant that your dental health needs to be shipshape before we start moving teeth around. We talk
Yes.
about the analogy of orthodontics like building a house. You need to have strong foundations to make sure that it's going to work. So the general dentist has a role to play anyway. Then the sort of second part of that is where does the orthodontic knowledge come in? And we think that there is certainly a case to be made for, yes, the orthodontist being involved, but also technology and also the training that we provide through we've got a kind of patent pending educational platform to deliver some of this education, but also the collaboration between clinicians who have different levels of experience can all come together to deliver the patient outcomes that they're looking for. So for the orthodontist, it's their orthodontic knowledge that can be used to contribute. For the dentist, it's their dental knowledge and their access to patients. And technology then plays a role to kind of to bring that all together. So I know that there have been debates about, well, should orthodontists do it? Should only orthodontists do it? Should only dentists do it? That debate has actually raged for a long time, and obviously starting in the US. And I think where it's landed in the US is that now 50% of clear aligner cases are done by general dentists. And those are not the same cases as are done by orthodontists. So
So
they will be
basically, the
taking on
simpler ones can be done by
exactly,
general dentists. If you are
exactly.
thinking there's complications or something, you need to go to someone who's an expert in it.
Exactly. And the way that, and that means that everybody wins, right? That the dentist wins because they take on simpler cases. The orthodontist wins because they still are treating a large number of cases. But what 32Co do differently is that we make sure that the orthodontist role is almost even bigger, in that they also support the dentist in doing their cases. One of the big challenges that dentists find is that when a patient comes in and you haven't been orthodontically trained, how are you supposed to know what's a simple case? Actually, the challenge is in unpicking the deceptively tricky cases that are actually maybe not suitable for a general dentist to treat, or maybe need input from an orthodontist. So the way that it works with 32Co is that both the orthodontist and the general dentist work together. And the cases where orthodontic input is needed, that consulting orthodontist is still a very big role, has a big role to play, but they are not having to visit as often because they have a trained general dentist colleague who can do the lion's share of the work with them.
Great. That's very good to know. Since we are talking about the problems general dentists face, okay, when they start with aligners, other than not knowing which cases to take and which cases not to take, what are the other common problems you have seen them face? Before you listen to the answer to that question, I want to ask you one. Do you want to grow your career in dentistry? Then look below. There's a subscribe button. Hit that because we keep on coming up with content to help you grow continuously in dentistry. And if you're liking this video, please do not forget to hit the like button below.
I think the major problem is clinical confidence, and that is just generally. I don't understand. You know, what is going to happen when the teeth move like this? Is this even realistic? You know, you haven't seen enough, and that's no one's fault. That is just the way that the dental educational system has been set up, and you know, one of the reasons why what we think we're doing in the training side is so important. Clinical confidence is number one, and that comes into firstly case selection, but also further down the line when you're actually starting to treatment plan. So for those again who are not familiar, when you design a clear aligner case, it's done on a computer. You know, do it through the 32Co platform, and you're presented with a 3D simulation of how the teeth are going to move. Now, with conventional brands, the sort of big brands, the person who is creating that 3D simulation, the tooth movement, is a technician who may or may not be dentally trained. So now the problem with that is when you then get that simulation back and you're not orthodontically trained, how are you supposed to know whether that's going to work? We see countless examples at 32Co where dentists who now work with us, who have previously worked with big, you know, with other big brands, present to us a simulation from them, and our orthodontists look at it and they go, there is just no way that that's going to work. It looks great on the screen, not a chance that that is actually going to happen in the mouth. So how are you supposed to know the difference? And that's where you get a lot of nervousness from, mostly from dentists, but from some orthodontists as well, who are used to the mechanics of a fixed appliance and perhaps not of the clear aligner. So introducing that confidence and having a much better training provided for free, and also guidance on, look, what is actually happening in this simulation. That's a big part of what we do in the platform, explaining this is what is happening, this is why, and this is how this is going to move, and this is what's not going to happen, is a huge factor in increasing clinical confidence among, you know, clinicians, both who are experienced and who are not experienced.
Understood. Now, if a general dentist, first thing he lacks confidence. Second thing, he lacks knowledge. Once he has knowledge, some amount of confidence he gets into trying and getting into these things. But on one hand, he has orthodontists. On the other hand, he has D2C brands, the direct to consumer brands. How do you think he could compete with these direct to consumer brands who tell, I'll come at your house, I'll do the scan, I'll do it cheap? How do you think they can arm up against these big D2C companies?
Yeah, I think it's probably helpful to describe how the evolution of the D2C market in the US was, which is where it was born. So the skill of the D2C company is in marketing. So what they're very good at is telling people about the clear aligner, advertising on TV, on billboards, and spending an enormous amount of money doing that. So they're popularizing the concept of the aligner. Once that patient comes in, what they realize is they're getting a very different service to what they would get with a professional dentist, right? So when you have direct to consumer aligners, you're not getting a full dental checkup, right? So we don't know whether those foundations are good, not necessarily getting radiographs. The aligner itself, when you're doing it professionally, and the way that it was designed to be used was with something called interproximal reduction, which is slenderizing of the teeth to create space, which orthodontists use all the time, and attachments, which are essentially little handles that help the aligner do the work. And there is so much evidence out there that those are needed in order to make these aligners effective. When you're doing aligners at home, you can't use any of those tools because you need to be a dentist to provide them. So actually what's been borne out in the evidence is that really at-home aligners can only treat a very, very small proportion of patients effectively. We're talking simple cases, relapse cases, so patients who have had orthodontics in the past and haven't worn their retainers. So it'll take a little while, but what has happened in other markets is that becomes clear quite quickly, and patients then become aware of the aligner, still want it, realize that D2C isn't the answer for them, and then go to their dentist. So it's actually an opportunity for the clinicians, in the audience to say, well, look, patients are aware of this. They want this treatment. Direct to consumer isn't the answer for the vast majority of them. I can now start offering something like this to them. Make sure that you do it safely, with the right training, with the right support, which is obviously what we do. And I can actually change my patients' lives and also benefit financially from that.
Understood. So basically, they are doing the hard work for us, marketing it to the patients out there, telling that such a thing, such a treatment plan exists. It's in our hands whether we want to grab the opportunity or not. That's a
Absolutely.
really good advice you have told us out there, and I've seen that happen in various other countries as well. So I'm hoping that will happen in India soon. You have an amazing company known as 32Co, in which you help train dentists who are not confident. You give them free training and you help handhold them towards these procedures. So, could you tell me a bit about your company and how do I contact you if I am thinking of starting with aligners, and how you can help me with that?
Yes, of course. So the 32Co platform is a technology platform, and it does three things. The first thing that it does is it trains dentists for free. And as I described, we have a very cool patent pending system whereby we personalize the training. So we train orthodontists as well. There is always something to learn. It's just different for different people. So if you're a complete beginner, you will get a completely different training experience with us to someone who's already experienced, who wants to learn the latest, the most advanced techniques. We have a full team of global world experts in not just in dental education and training and orthodontic academia, but also in edtech in general. So taking it away from the sort of conventional dental training and thinking, well, how can we do this differently to make it more modern, more appropriate for, and actually more enjoyable as well for clinicians, because learning is easier when it's more fun. So that's the first thing that the platform does. So any dentist who signs up with us, if they're ready to start and they are motivated, they will be allowed onto the platform and they will be given that training. And these are sort of long kind of multi-week training sessions that we offer. The second thing that we do is when you are then ready to get started offering clear aligners, you will be able to work with either your consulting orthodontist or one of our kind of global top expert orthodontists on a case if you wish. That means that you always have the backup of someone who really knows what they're talking about to support you in case selection, treatment planning, understanding what's going to happen and what isn't going to happen. And what we see is usually orthodontists signing up together with their dentists so that they can essentially start providing more and more of this treatment. It also means that as an orthodontist, you can expand the scope of your work significantly beyond your existing practices, because you can use technology to reach new dentists that you can work with, and you don't actually have to go and visit them because the platform does that work for you. The third thing that we have is the world's first clear aligner marketplace. So we have worked with every single clear aligner manufacturer in the world, I would say now. We have tested them rigorously, and we have curated now the global top manufacturers who produce the best quality aligners. And we give dentists choice. So now, rather than having just being tied into one brand, one set of pricing, one type of material, you have access to all of them. And you can make a decision yourself about what you think is the right material, finish for your patient every single time. And we think that by creating choice, we're putting the power back into the hands of the clinician, and allowing them to really feel ownership over the treatment that they're providing. So signing up is really simple. www.32co.com. There you can find links to signing up, and also all of the courses that we're offering at the moment are detailed out. And as I said, it's free. That's really important to me and to the company. We don't think that training should be behind a paywall, especially for something like this where patients are pushing for it. We want to just increase access to care as quickly as possible and make sure that that care is clinically rigorous and backed by evidence and by great training.
Oh, that's a really great things you're doing. You're actually solving the first three problems they would have. The first problem of understanding the entire concept. Second is, even if I'm not confident enough, I've got the basics. I have someone who will help me throughout the case. And the third, you've made an Amazon basically for the various aligner companies out there. So I can pick and choose which company I want to work with and how do I want to finish. I really don't understand why there was such a company before, and I really thank you for coming up with such a fabulous idea where it will surely benefit a lot of dentists who are planning to get into this. I'm sure after this video, a lot of people who are sitting on the fence would ideally want to get into 32 Co and see what's there. Because until you dip your toe, you will not know how the water is, you will not get a feel of it. And they are there to help you throughout the entire process. So thank you, Dr. Sonia, for making such a wonderful company.
Thank you so much.
It's lovely that you have come here, given us your time, valuable time, and spoken to the audience, telling them how aligners is, how it can benefit them, and how they can get it. Thank you for taking your time out.
Thank you. I really appreciate it. And what an amazing community that you've also built. And thank you for taking the time at this busy time of year to speak to me about what we're doing.
Thanks a lot. Thank you. Do you agree with what Dr. Sonia has told in this interview? If yes or no, please give your valuable comments in the comment section below. Also, do not forget to check out our other videos where we help you grow your career in dentistry. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed.